Haemochromatosis Awareness Week, with the National Awareness Day planned for tomorrow, with stands in Mahon, Douglas and Wilton shopping centres. Joining me to discuss haemochromatosis is consultant endocrinologist at the South Infirmary Victoria Hospital, and that's Dr. Matt Murphy. Good morning to you, Matt.
Good morning.
And you are welcome. Now, for those who know nothing about this hereditary condition, just explain what haemochromatosis is.
Haemochromatosis is it's a clinical condition where you have too much iron in your body, and it begins to cause your body to not function very well. Too much, causing problems with many organs in your body.
How common is it?
It's the commonest genetic condition we deal with. It's quite common. It's up to about 1 in 200 in the Irish population, so it's not rare.
And the symptoms?
The symptoms are unfortunately very non-specific, but the commonest symptoms would be low mood, chronic severe fatigue, and in men perhaps difficulty with sexual drive, sexual function, and joint pain and joint swelling.
And is it both men and women, or is one more than the other?
No, very much so. Both men and women can be affected. Men tend to be affected younger in life. Women tend to be affected perhaps after the menopause. When they lose their periods, they tend to accumulate their iron a bit quicker.
And if it's undiagnosed, what are the dangers?
Well, the dangers are like any condition, there's ongoing damage happening in the background, damage that could potentially and in reality could have been prevented and reversed. The most common perhaps and the most serious would be huge accumulation of iron in the liver, which could lead to liver failure or liver cancer. Goodness.
And when it is diagnosed, then the treatment is rather unusual. It's not taking a tablet.
No. First of all, the diagnosis is it's quite straightforward. It's a blood test with your local doctor, your general practitioner, and it's a measure of your iron levels. We measure iron in 2 different levels. We've got the ferritin, which is your total body iron, and you've got a fasting transferrin saturation, which is your tendency to accumulate iron. The transferrin saturation is abnormal first, and that's what the screening test would be. Yes, because you have too much iron, it seems like a crude treatment, but by far the best way to remove iron quickly is to take off blood, and it can be done as a blood donation.
Because at one stage you couldn't. You couldn't be a blood donor if you had haemochromatosis.
No, and indeed there were patients who had donated blood for 40 years. My predecessor, Dr. Walsh, had a patient who had a gold pin for donating 50 units of blood, was diagnosed with haemochromatosis and was then precluded from donating any further blood. That, however, has changed. In about 10 years, the Irish Blood Transfusion Service do a haemochromatosis programme.
Why, Matt, is it mainly a condition only diagnosed in people of European origin?
We don't know the reason for that. The gene is much more common in European, in particular Irish people.
Are more GPs testing for it than ever before?
Yes. There's increased awareness. That's what the function of these weeks are to raise awareness of conditions. The gateway to this, chronic fatigue, is such a common symptom, and many people will often self-medicate. They will go for a tonic or an iron tablet because they think they're iron deficient. And when they fail to respond to taking that tonic or that iron tablet, they will then often present for help to their GP. GPs then would be aware and they would check for iron because low energy is a symptom of both low or high iron, and GPs would very commonly test for it.
And obviously somebody feeling tired, and as you say, I just need a good tonic, and they go and take a tonic that's full of iron, it's probably the worst thing somebody with haemochromatosis can do.
Well, I think it's more to take it on an ongoing basis. If you have the chronic fatigue and you're not responding to the tonic, maybe it's not an iron deficiency, and to continue to take the same medication could indeed certainly be not of any benefit, but yes, in theory, be potentially harmful.
Okay, a question from a listener who says a close family member had haemochromatosis and was giving blood for a long time. I've asked my GP to test me for it, but he's refused. I do have anemia problems, and he said the two are not linked.
That's probably true, because if you have anemia, the common cause of anemia is a low iron. However, patients can have the tendency towards haemochromatosis without having any of the damaging effects of over or excess iron in their body.
So you would say go back and ask for the test?
That's what I would say, yeah. But be politically sensitive about it.
Okay, but if a family member is diagnosed with hemochromatosis, is that the general advice that certainly siblings should all be checked?
Yes, siblings over the age of 18, because they're adults, should also be tested. We don't test children routinely for hemochromatosis because the iron doesn't accumulate until you're an adult. So adults should be tested, not children.
Does being a vegetarian help?
No, the amount of iron in a vegetarian diet is actually quite high. Yes, some patients do avoid meat and some patients do avoid excessive alcohol and vitamin C because that increases the absorption of iron. But the amount of iron accumulated is really, really high, and diet doesn't have a major impact. The amount of blood we take off with a single venesection, a single blood donation, will certainly outstrip any benefit from restricting iron in your diet.
Okay, the ambulance is the background. I'll let you go. Listen, thanks a million for that, and thanks for joining us.
Thank you very much.
Good
Bye-bye.
morning to you. Bye-bye. That is Dr. Matt Murphy, consultant endocrinologist at the South Infirmary Victoria Hospital. And as I say, if you are out and about tomorrow, Mahon, Douglas and Wilton shopping centres will all have information stands if you want to find out more about hemochromatosis, because it is the Awareness Week this week, but with a special focus here in Ireland tomorrow. It is about 5 minutes, a little over 5 minutes.